people today. They could spend half their lives over 50. That's a lot of living. So it helps to have a wise friend and fierce defender in your corner. A friend like AARP. So your health lives longer.
This is just slow-mo karate?
Just slow-mo karate.
Your money lives longer.
I just bought that.
I just sold that.
And your happiness lives longer. That's why the younger you are, the more you need AARP. Join today.
Welcome to AARP Illinois' virtual event. It's so wonderful to have you with us. AARP is on a mission to connect with individuals across various communities, especially those aged 50 and above. We're here to listen, understand, and address the unique needs of you and your community as we age. Our goal is to enrich your experience by expanding our local activities, providing opportunities for you to discover and engage with all that life has to offer right here in your own community and virtually. As we journey through today's event, we invite you to consider joining our dedicated team of AARP volunteers. It's a chance to make a meaningful impact and help us better serve those 50 plus across the nation. Connect with us and be a part of this vibrant movement toward positive change. Welcome, and let's make this event both fun and transformative.
Good afternoon. My name is Sonia Gibbons-Reed, State and Community Engagement Analyst for AARP Illinois. AARP is a nonprofit and nonpartisan membership organization that's been working to promote the health and well-being of older Americans for more than 60 years. Today's virtual event is focused on Menopause Awareness Week. We are honored to have you join us for a powerful and enlightening conversation, shining a light on women's midlife health. Today, we're joined by Dr. Maura Quinlan, Women's Health Medical Advisor with the Illinois Department of Public Health, a passionate advocate for women's health, and an expert in guiding patients through the transitions of midlife and beyond. Dr. Quinlan, thank you.
Yeah, my pleasure. Happy to be here.
I'm confident that our 30-minute conversation with today's guest will be insightful. And if you would like to stay on top of the most recent and up-to-date information after this event, you can visit states.aarp.org/Illinois. As always, please feel free to drop your questions in the chat, and we will get to as many as we can during our conversation. So with that, let's get started. Dr. Quinlan, thank you again for being here. Can you tell us what exactly is menopause and how is it different from perimenopause and postmenopause?
Sure. So menopause really it defines a period where the ovarian function has stopped, ovulation hasn't happened, no longer happens, and clinically, it's defined as a full year without a menstrual cycle. So if a person was having regular cycles, the perimenopause is the months to years prior to menopause, where pregnancy can still happen. There are menstrual cycles. Women are having their periods, but they're irregular. So that's premenopause or perimenopause. Once it's been 12 months without a period, that's the definition of menopause. And then postmenopause is just all the time after that. So that 12 months, I have patients, they get to 10 months and I'm like, you're almost there. And then they have a period and then the clock starts again. So the definition is full 12 months without a period.
Okay. And what are some of the most common symptoms women experience, and why do they vary so much from person to person?
Yeah, the why is a much harder question to answer. Some women, it's sort of, I think of it as like people who have painful periods, mood swings during their period. Some people have a lot, some people have nothing. Some pregnant people have, morning sickness, all that stuff, all of those things, some have nothing. So menopause is similar in that some women, I'll say like nothing, you don't have any hot flashes, nothing. And some women really have very little symptoms. Some of it's genetics. There's a variety of things that cause that. But Most women do have some symptoms. The most common is hot flashes, which is where the temperature is the same where you are, and you get this power surge and you turn bright red and pour sweat, and it's a whole thing. So hot flashes are real, and are some of the most common things. They can happen every few minutes. They can wake you from sleep. So we call those vasomotor symptoms, but the general name is hot flashes. That's really common. Mood swings, sort of mental health things, mood swings, anxiety, brain fog. I personally feel like a lot of those things are related to disordered sleep. If you think for those who've had an infant, when your baby's tiny and you're waking up of course you're cloudy, you're tired, you're can be a little cranky. So mental health, anxiety, brain fog, forgetting things, is part of menopause, and some sexual dysfunction issues, vaginal dryness, which can cause pain with sex, is quite common. So the vasomotor symptoms, hot flashes, symptoms related to low estrogen that can cause vaginal dryness, sleep disorders, those are kind of the big ones. There's a variety of other things though, joint pain, there's a variety of other, a little bit less common symptoms that can happen for some people during menopause. Those do tend to get better, most of those things. The vaginal dryness tends to get worse, but hot flashes are most frequent right around the early days of menopause. And usually when women are many years past the hot flashes get better.
Okay. So how much do genetics or lifestyle influence the timing of menopause?
The timing of menopause is quite genetic. Women, when I have someone who's in their mid 40s and wonders if they're going through menopause, I always ask, do you have older sisters, your mom, aunts? Like, what's the typical age? It's similar to starting menstrual cycles when puberty happens, tends to have a little bit of a genetic component. So that is relevant. It's especially common for women I see in their 54, 55, and they're like, what? How am I not done yet? And then they say, oh, that's right, I'm always around this age. So lifestyle doesn't affect the timing of menopause as much as the symptoms. We know healthy diet, vigorous exercise tends to make those symptoms better.
Okay. As women enter midlife, they often face both physical and emotional changes that can impact their well-being. What are the most pressing health concerns that you've heard for women in their 40s and 50s?
Yeah, it depends a lot on the person. I think menopause symptoms, and as I mentioned, all the downstream things, women are bothered by hot flashes, having trouble sleeping. They might be having an empty nest, life things that happen at the same time, job issues, marriage issues, can be a perfect storm for some folks that happen around this time. Other common issues are things like urinary incontinence. Hypertension is more likely to happen as women get older, diabetes, need for cancer screening. So I would say that for women in 40s and 50s, I think symptoms of menopause seem to be the most common reason people see me, although as a gynecologist, obviously I have a selected population, but those are what tends to be new symptoms that need, attention.
Okay. Can you talk about the connection between menopause and mental health? So anxiety, depression, and brain fog. You touched on that a little bit, but does it seem like it gets worse during menopause?
Again, it's hard to say that not everyone is the same with this. Some people will have zero. And I worry that I don't want anyone to hear this, or people that aren't going through it, to think, well, don't trust a menopausal age woman's judgment. She's in menopause, so she doesn't have clear judgment. That is not true. And there's a lot of us in this age who do great things, hopefully. So it's not to say that you're not able to think clearly, that everyone should have their judgment clouded by whether or not they're in menopause. However, some women do describe, again, I think a big part of it in the throes of menopause, when the hot flashes are worst and someone is waking up, every hour in the night change your pajamas, bed sheets are soaked. Clearly the next day you will not be 100% on your game. So I think that fog or that distraction that perhaps leads to anxiety, depression, that what's going on, I'm not the person I felt like I was 5 years ago. Those things can certainly all come together. And there's lots and lots of ways to treat them. You don't have to suffer.
Okay, great. This is such important information. And I want to remind our listeners that if you have any questions, please put them in the chat and we'll get to them. Can you differentiate between normal changes and symptoms that might need medical attention?
So that's a good question. My short answer would be things need medical attention if they are really impactful. So I have people I see for their annual and they say, oh yeah, actually it's been 18 months since I had a period. And I say, well, how you doing? And I'll kind of go through any symptoms and they say, yeah, occasionally it's not, especially people who are cold all the time say, I kind of like it. I'm not freezing, so it's okay. So for those women, medical attention is not needed if their symptoms are not bothering them. But if I had someone the other day who was a junior high teacher, fair-skinned woman, and when she has a hot flush, she turns bright red. Her junior high students love that, and they make a joke out of it. And she's laughing with them, but she said, "This is a problem. I can't concentrate." So even though it's a normal physiologic change, if it's impacting your life, don't suffer. And if someone says, buy a fan, that's not enough. You need to see someone who can help you. So I think the decision whether or not it needs medical attention is whether it's bothersome. That's what we're here for.
Right. And I think, like you said, you don't have to suffer.
Correct. And I can't tell you how many patients have told me that a provider told them to get a fan. And I was like,
that's not helpful.
That is not helpful. And can I just guarantee that person has never been in your shoes? So.
Right. Are there particular health screenings or tests that you recommend for women during this life stage?
For specifically to address the menopause issues, there's some, and I don't know if we're going to touch on that, but there's some social media stuff. There's stuff on the internet that's just very wacky about blood tests, and you can get a cheek swab and send it, and it'll tell you if you're going through menopause. Not necessary. So specifically for menopause, there's no specific test. If I have a patient who's younger than the typical age, I might do some hormone testing. If I have a patient who's much older than the typical age, I might do some hormone blood tests. But if someone is, early 50s, late 40s, early 50s, has classic menopause symptoms, there's not special testing that needs to be done to go ahead with the treatment. If they're interested, typical screenings, people should be still getting their mammograms. Colon cancer screening should start at age 45. Mammograms start at age 40. So those, Pap screening every 1 to 5 years, depending on your history and your recent Pap results. So the breast and cervical cancer screening is unchanged. Should be happening around that same time.
Okay. And as you mentioned, there's a lot of information out there on the internet. So let's tackle a few myths and treatments. So there's a lot of confusion about hormone therapy. Can you walk us through the risks, the benefits, and who might be a good candidate for that?
Yeah, happy to. So hormone replacement therapy, now we call it menopause hormone therapy, but we'll call it hormone therapy just to break even, is the replacing, in menopause, the ovaries stop producing estrogen and progesterone. The drop in those hormones, particularly the estrogen, is what causes really all of the symptoms. So it makes sense. What if you give back the hormones you're not making? You're all, there you are. The person would likely be much better, which is a true statement. However, in 2002, so I was practicing then a long time ago, a study came out that looked at women taking hormone replacement therapy, as it was called at the time, and it showed a higher risk of breast cancer for the women who were taking it. Huge. However, the women taking it were older. They were not women, and necessarily the average age was not the age we use now. They were taking the single pill form. We have many other forms now. So that in 2002, really, it was a huge sort of fork in the road of hormone replacement link. However, so many, and it made the news, so many studies since then have kind of disproven or added some nuance to it. And for a sad reason, those have not gotten the press as the one that said, that the headlines were hormone replacement and breast cancer. So we know now that the risk of breast cancer in someone who takes hormone replacement, even in that study, it was 8 more cases of breast cancer per 10,000 women taking the hormone therapy. So the risk is extremely small, and we have made it smaller by having more options for treatment. Hormone replacement can be used in a patch form, an estrogen patch, which goes on your skin. They last for twice a week or a week long, depending on the formulation. That doesn't affect cholesterol. So some of the cholesterol risk of hormone therapy is not the case with the patch. So there are risks to it. The benefits are massive. It really, for most women, it eliminates menopause symptoms. So it's a shared decision making that we have with our patients. Certainly, if someone has a history of breast cancer that is estrogen or progesterone receptor positive, we cannot give them estrogen and progesterone. We have other options. But if they have a strong family history, if they have a genetic predisposition to breast cancer, we wouldn't use it. It's just a judgment, an individualized decision. But I can tell you, for the vast majority of women, the benefit of hormone therapy outweighs the risk. So I think it is just worth a discussion. If this doesn't bother you, you're good. No worries. But if this is really impacting your life and we have something that will help, that the benefit is huge, the risk is small, many women elect to do it.
Right. And so over the years, the past 20 years or so, it's come a long way. And
such a long way.
Yeah.
Right. And the sad thing is it's come a long way, and yet the word on the street is still it's bad for you. I feel
Right.
like, no, it's not. Like, and so folks who trained a long time ago or who don't work in the menopause with patients who are coming for menopause care, just nope, you shouldn't be doing it. And that's talking from 2002. There's a lot we know since then.
Right. Are there effective non-hormonal treatments or lifestyle changes that someone can make that will really make a difference?
Yeah, there's the diet and exercise is helpful. The obvious things, dressing in layers. I think most women who are going through menopause don't ever wear a scarf. My turtlenecks stayed in the drawer. A turtleneck is a nightmare if you're flashing. Thin wear clothes, dress appropriately. Diet and exercise can really help. It seems like, what difference would that make? But really, exercise, a woman who's at that age, if you are pretty sedentary and you walk kind of briskly for 15 minutes a day, you could really notice a difference. Sleep will be better, et cetera. So some of those just general health measures can help with menopause symptoms. Soy products. So soybeans have a plant-based estrogen-like component. So just dietary soy milk, edamame, soy bars, that kind of thing can be helpful. I would caution the folks watching this. My sister called me yesterday, it was so timely, asking me about supplements. She had a friend who is taking like A through Z, and I'm like, all right, here we go. So I'm looking up what all these things are. They're not cheap. There's just, if you see something on social media, whatever, it comes up as you're online, and it's some supplement of some sort, look at who's providing that information. There are some folks who are physicians who started out as good social media influencers talking about the science like we are now, and then sort of went down the path of now promoting supplements. So very few of those have any science. Most of them aren't harmful. Some are, but they have no science behind them. So beware of things that say like, you should take this, 50-year-old woman for XYZ, safe, natural, some of those words and just dig a little deeper to make sure.
Yeah, maybe have that conversation with your doctor before you go spending all that money on something that isn't even going to work.
Right. And there's websites, and my patients that brought them to me, their websites look slick. The earliest one was a physician, and I looked him up and he was a podiatrist. I'm like, okay, that's feet. I'm not online doing feet care because that's not what I do. So, I was with my patient. I was like, come on, it only took a second. I just Googled this guy. So, and there's a financial, piece of it that folks get paid a lot by these supplement companies, but
absolutely,
just beware. I hate that people getting preyed on when there is something that will work.
Right. What are some common myths about menopause that you wish more people understood the truth?
I think the myth of tough it out. Women tough out everything. You don't need to tough this. I mean, if you want to, go crazy, but you certainly don't have to. So that myth of, you're weak if you acknowledge that this is really rough. That's a myth. It's okay. If someone who has chronic back pain is not usually told to tough it out. They get a range of options for treatment, and menopause should be no different. So I think that's the biggest myth, is that you should tough it out. There's nothing that will help. Those are the two big ones that I see. And the myth that hormone replacement, I think menopause hormone therapy is bad. That's incorrect.
Yeah. And I think it's very important that people have the conversation instead of suffering alone.
Right.
Another important piece to touch on, access to care can be a challenge for some women, especially in the underserved communities. So how is the Illinois Department of Public Health working to increase access to menopause care and education?
Yeah, so the Illinois Department of Public Health has a variety of funds some clinical programs in women's health. There's a family planning program that IDPH administers, has sites around the state to provide contraceptive care for folks. There's a breast and cervical cancer program that provides breast and cervical cancer screening for uninsured or underinsured folks. So those are direct clinical care support of IDPH. There's not such a thing for menopause care. We don't, IDPH is a public health entity, so we don't provide, direct clinical services. So for menopause care, what IDPH does is just try to amplify the education. What we're doing here, our social media had information about Menopause Week. We worked with the Lieutenant Governor's office, who had a menopause speaker series recently. So it's mainly to get the education out there. But access is a challenge. And I think we'll talk about resources in the end, but there's a menopause.org. There's a website of the National Menopause Society that will help people get access to a provider specifically trained in this, and many have telehealth because you don't really need an exam. Like when I see these patients, it is something that's good for telehealth. So people who are virtual, some of these social media people will say, for $1,000, you can do a consult with me. That seems so much money, and you can do that for less. There's closer providers.
Right. We did have a question on YouTube from Susan. I am 67 and have had hot flashes for more than 25 years. Will this ever end?
Yes, I'm so sorry. That is real. That's it's sort of a bell curve that most people have hot flashes just for 6 months to a year, but there's some people at sort of that tail end that have them longer. The challenge is the hot menopause hormone therapy will really reduce them, but the standard is to not start menopause hormone therapy for someone who's more than 10 years from menopause. That if someone's that long from menopause, the risks of the hormone therapy are greater than the benefits. The only other thought, and when I see patients who are having them, I do things like I check a thyroid level just to make sure, are we calling these hot flashes when really there could be something else medical? So I would love to tell you they'll end soon, but some people do get them longer. But I would just double check with your doctor, especially this long out. It's worth checking to make sure they're not being caused by something else.
Yes, I've heard a lot of people complain and say that, this menopause thing never ends, but 25 years is a long time.
And especially some people will get them just rarely, or some people have a trigger, spicy food, red wine, being super hot, whatever. But it should, they hopefully, they usually get significantly less over the time.
Another question from YouTube. I am 55 with menopause and weight loss has been an issue for me. Any suggestions?
I wish. So I had a patient say a while back that was, and I've seen it since then, called a menopause, which is this weight distribution changes. It's not in your head. I live in it. It's not in your head that you really are the same. You're kind of eating the same. You're exercising the same. And you have this sort of lower abdomen weight distribution, extra weight that you didn't have before. No miracles. Menopause hormone therapy doesn't really change that weight gain. So it's a matter of, a little fewer calories, a little more exercise, Spanx, but there's not, weight loss it's commonly an issue as women get older, and men too.
Yeah. One more question from YouTube. What are your thoughts on AHCC?
I don't know what that is. There are so many. I mean, again, when my sister sent me this stuff that her friends take, I was like, oh my gosh, here we go. Some of the supplements and some things that I know by their medical name, a company will change the name and make it their own and put initials on it. So I would need to know. I'm trying to guess at what those letters could be.
Yeah.
Hormone. I don't know. I would need more information. Sorry.
That's okay. Do you know of any community resources or support groups that you could recommend for women going through menopause?
Yeah, I think the site that is a nonprofit, not, paid for by pharmaceuticals, whatever, it used to be called the North American Menopause Society. It's still called that, but their website is easy, menopause.org. It's a professional group of certified menopause providers. So those of us seeing patients can get additional certification to be a certified menopause provider. We have to do keep current, and there's a variety of things we do to keep this status as that kind of provider. But menopause.org does have, I looked at it this morning just to make sure that nothing had changed. They have a place for patients, one for providers, and there's great, it's just the party line, like the standard, no one's selling you anything, just here are some options. And they give a good listing of what can I do other than menopause hormone therapy. There's good science to show it works. There's science it may work. There's science it's dangerous. So they have that listing there and more resources for patients. And there's also a place for find a provider. So if everywhere you go in your health system, they say get a fan, don't give up. That site has folks by zip code, and many people have telehealth.
That's very helpful. Menopause.org, you said.
Menopause.org, easy
Okay.
peasy. Yep, right there.
We'll remember that. Okay. Dr. Quinlan, thank you so much for sharing your expertise and your compassion with us today. This conversation has been incredibly empowering and informative.
My pleasure. Don't suffer. Nobody should.
There you go. There's your tagline.
Yeah.
Aside from that, any other final words of advice or encouragement for women navigating this stage of life?
No, I think, I saw a post one time about never underestimate the strength of a postmenopausal woman. And I think that's true. We're like the elders. You don't have to worry about getting pregnant. It's not the end. It's just a stage. Get through it with grace, like everything else.
There you go. To everyone who joined us, I want to thank you, and let's keep the conversation going. Talk to your doctors, support each other, and never be afraid to shine a light on your health. If you're looking for more information from AARP, please Google your website or our website at AARP Illinois or at states.aarp.org/Illinois. Thank you and have a wonderful day.
Thanks, everybody.